Hello there. In today's video, we will be discussing about meningitis. Meningitis, as you can make out from the name, whenever you come across a term itis, it is always inflammation. So, by definition, meningitis is an inflammation of the leptomeninges, which is caused by the infectious agent. Now, there are a variety of infectious causes. First of all, we have divided it on the basis of the infectious agent and the age. So bacterial meningitis is caused by S. pneumoniae, H. influenza and N. meningitis. In the neonatal group, the basic cause of infection is group B streptococci, E. coli and L. monocytogenes. There are viral causes: mumps, ecovirus, varicella zoster, streptococcus aureus. Mycobacterial tuberculosis. Fungal, Cryptococcus and Candida. Now, acute bacterial meningitis, the pathophysiology is transmission, colonization and invasion of the nasopharyngeal epithelium. After this invasion, survival in the bloodstream by evading host immune response. The host immune response is compromised. Meningeal invasion, bacteremia, that is presence of bacteria in blood, may be rapidly followed by seeding of these meningeal pathogens and secondary infection to the meninges. CSF inflammatory response is a result of all this invasion by the pathogens. A purulent, that is a foul smelling exudate is most evident in the basal cisternae, which extends throughout the subarachnoid matter or the subarachnoid space, the underlying brain. It is not invaded by the bacteria. The areas which are not invaded by the bacteria becomes congested, edematous and ischemic. The integrity of the parameter normally protects against the formation of the brain abscess. Inflammatory exudate may also affect vascular structures crossing the subarachnoid space, producing arteritis. Arteritis is inflammation of arteries, venous thrombophlebitis with a resultant infarction. Similarly, cranial nerves suffer the direct damage because of their presence. The clinical features are infection which will lead to fever and rigors, increased intracranial pressure leading to headache, nausea, vomiting, deterioration of consciousness, hypertension, bradycardia. Meningeal irritation and inflammation is manifested as neck rigidity, a positive Brudzinski-Koenig sign, and photophobia. Photophobia is inability to tolerate light. Cranial nerve palsies of third, fourth, sixth, and seventh cranial nerve and resultant symptoms of each cranial nerve supplying a particular motor, sensory, or a mixed portion. Focal neurological deficits include nystagmus, oscillatory movement of your eyeballs, aphasia, difficulty in speech, ataxia, hemiparesis, hemianopia, and papilloedema. Systemic signs are high fever and Waterhouse-Friderichsen syndrome. Now, this was all about bacterial meningitis. Tuberculous meningitis, causative agents is Mycobacterium tuberculous or Mycobacterium bovis. Pathophysiology, it usually results from bacteremia following initial phase of pulmonary tuberculosis. It is always secondary to pulmonary tuberculosis. Following bacteria, the metastatic foci of infection lodges in the meninges, cerebral or spinal choroid plexus and spinal tissue, rupture of encapsulated foci, resulting in spread of infection in the subarachnoid space. Clinical features: the prodromal stage consists of sensory irritability, stage of meningeal irritation, and terminal stage of coma. Prodromal stage of sensory irritability is characterized by insidious, that is a slow onset, high fever, headache, restlessness, anorexia, that is loss of appetite, vomiting and constipation. Stage of meningeal irritation is characterized by convulsions, positive Brudzinski's Koenig sign because of meningeal irritation, tense anterior frontale, crackpot sound, that is whenever you tap over the anterior frontale you will get a crackpot sound, exaggeration of deep reflexes, grinding of teeth, muscular twitches, squint, ptosis, pyrexia, and disturbance in consciousness. Cranial nerve palsy, hemiparesis, quadriparesis, ataxia, and dysarthria. Terminal stage of coma, there is a rapid weight loss and dehydration, tachycardia, irregular pulse, kind stroke, breathing, tremors in the limb, terminal hyperpyrexia, and decerebrate rigidity. Acute syphilitic meningitis, there are three clinical forms: asymptomatic, aseptic meningitis, which is characterized by fever, rash, malaise, neck stiffness; acute basal hydrocephalus, which consists of cranial nerve palsies and papilloedema. Viral meningitis, the causative agent is enterovirus, mumps virus, herpes simplex, and Epstein-Barr virus. Clinical feature is again divided into three stages: prodromal stage, which is characterized by fever, malaise, sore throat; meningeal phase is characterized by headache, photophobia, drowsiness, and then there is a recovery phase. Investigation, the gold standard investigation is CSF examination, blood culture, immunological test. This immunological test consists of latex particle agglutination. A CT scan is done. In CSF examination, there is presence of any of these bacteria or pathogens are present. Blood culture will again be consisting of blood culture consists of pathogens because of the systemic invasion of these pathogens in the blood. Immunological test means whenever presence of any immunoglobulins against this against this pathogen is seen, and then there is CT scan for any of the structural abnormalities.